Hi, everybody, Dr. Daniel, and today I'm talking about Qulipta for migraine prevention. Qulipta is also called atogepant, and it's been released by the FDA for treatment of migraine. It's a blocker of CGRP, one of the chemicals that's released in the brain during a migraine headache. Now, persons with migraine can be called migraineurs, and these folks will have sensitivity to light and things like that during a migraine headache, but they may be sensitive to light all their life anyway. And I can remember patients telling me that they could never sit in a restaurant facing the window. They'd rather have their back to the window. That made them more comfortable. And patients with migraine in general might state that bright light like a strobe or glancing light off of a car surface can set off a migraine. And of course, during the migraine, then they're very sensitive. They have to wear a cap with a brim on it or maybe sunglasses. And they may also have motion sickness. And motion sickness is a very disabling, awful experience. I've had that myself. And motion sickness is worse in cars. It's worse than riding in boats. I can remember when I was in the Navy during the Vietnam conflict in San Diego, I had to release a man from the service who had severe motion sickness. Also, it's disabling. It's about the second most disabling medical condition in the world anyway. So we need new drugs that are oral, that are convenient, that work for this. It also can be found, migraine also causes disability. So you have to miss work or school, and it can run up bills for health care, such as doctor visits, medication, or MRI scans. So in September of 2021, the FDA approved Qulipta for episodic migraine prevention. And it's a drug that blocks the CGRP molecule, which comes out during the migraine process. CGRP, neurokinin, and substance P are released during the migraine process. The other advantage here is this is an oral pill that can work quickly without a lot of side effects, and it works well with other medications. So what kind of drug is this Qulipta? Atogepant. It's called a gepant drug, and that's a class of drugs that are oral that block the CGRP molecule. Other drugs in this class would be Nurtec and Ubrelvy. So it is thought that during the migraine process, the trigeminal nerve turns on, the arteries dilate, there's chemical inflammation from 3 neurochemicals that come out as part of the migraine process, and these neurochemicals are CGRP, neurokinin A, and substance P. But with practical use now of several drugs that we have for blocking CGRP, we can see that it's really probably one of the most important of the neurotransmitters that aggravates migraine problems, period. It is thought that during migraine, the trigeminal nerve is activated and inflamed, the cerebral arteries are dilated, and these chemicals that come out during the migraine process, which are called neurokinin A, substance P, and CGRP, are all released, and they actively inflame the thalamus, which is the pain center in the brain. And there's been a need for an oral drug for treatment of this sort of thing, and Qulipta is an oral drug. What are the other drugs that are gepants that work like Qulipta? Well, Nurtec and Ubrelvy are the other drugs that can be listed here. And the latest one is Qulipta, as mentioned. What are the common side effects of taking this medication? So one can get constipation, nausea, or upper respiratory infection. What were the results from studies using this drug to treat migraine patients? Well, one study out of 900 patients found that headaches occurred at a rate of 4 to 14 per month, and that gave an average of about 8 per month. The pill comes in 3 sizes, 10 milligrams, 30 milligrams, and 60 milligrams, and they're all effective. There's not that much difference between the different size drugs and the efficacy of the drugs as they're given. A question one might ask is, does Qulipta work for chronic migraine? Well, unfortunately, it has not been completely investigated for that, nor approved by the FDA. And so chronic migraine, according to the International Classification of Headache Disorders, version 3, is someone who has 15 or more headaches per month, 8 of which have migraine features that last studied over 3 months. There is a study ongoing now to use this for chronic migraine patients, and we'll just have to let you know that on another blog later on, or another podcast or video. I want to read you what some experts in the field of migraine have said about this drug. So we're talking about Richard Lipton, who's at Mount Sinai in New York. He was stated as saying, "It's exciting to see CGRP targeted therapies mature. We have known for many years that CGRP plays a crucial role in the biology of migraine, thanks to the pioneering work of Lars Edvinsson and Peter Goldsby. Now we have 5 agents approved for the preventive treatment of migraine that specifically target CGRP." So I think this is good news for the migraine community. Please check me out on podcasts and also my blog website, which is www.drmigraine.com. I'll see you again on the next talk. Good luck.